Live now. Please start.
Can I start, ma'am?
Yes, please.
Okay, thank you for giving me this floor. Good morning, everyone. Good afternoon to some, it's evening. My name is Sean Mngale, and I am honored to be here with all of you today as a moderator. I'm currently a fellow at Women Ascension under the Department of Women Ascension Community Outreach. It is a privilege to connect with all of you visually for this important discussion of health education, tackling geriatric health and the role of education in prevention and care. Someone may ask about the organization and the WACO department. What is it? For those of you who may not be familiar, WACO, or Women Ascension Community Outreach, is an initiative dedicated to empowering women and communities through education, advocacy, and support. Our work focuses on various social issues, including health, education, and social justice, with a particular emphasis on supporting marginalized communities and fostering positive change. We are committed to building bridges of opportunity and creating a supportive environment where everyone has the resources they need to thrive. Now, it's an honor to introduce our speaker, Ms. Nosheen Navid. I hope I'm calling the name correctly.
Yes.
She is an experienced nutritionist and public health expert, having worked with diverse experts, Nutrition International and the School of Nutrition, Pakistan. With expertise in counseling, maternal nutrition, and program leadership, she has made a significant impact in healthcare. Please welcome Nosheen Navid. Now I would like to give the floor to Ms. Nosheen. Ms. Nosheen, the floor is yours, ma'am. Thank you.
Thank you, Sian. I hope I'm pronouncing your name correctly. Sian
Yes,
Mungale.
ma'am. Thank you.
Yeah?
Yes, ma'am. Yeah, you just pronounce it nicely and correctly.
I'm glad. So, hello everyone. It's afternoon where I'm actually residing in the UAE. I don't know the other time zones, but whatever it is, greetings to all of you. I would love to know or what kind of studies you are all into. Maybe someone is a psychologist, maybe someone could be into nutrition, someone could be a health professional, someone could be just here to kind of know how to help their elder ones or older ones back at their homes. So I would love to know about you guys. If you could write in the chat box simply your name and whatever you're doing, studying, your major, or maybe the institutions that you're working in. By the time you guys type in, I would share my screen. Okay. I hope you guys can see my screen. And I'm just going to go back to the chat box. Okay. Health informatist and nutritionist. Okay. Doctor of physical therapy, public health officer, midwife. So good. We do have a lot of health sciences background here. Good. Okay, finance. Okay, good, Roya. IT support specialist and certified professional director. Hi, Whitney. Okay, great. So he have multiple backgrounds. Someone is an agriculture major here, market and agribusiness, computer science. Good. We have diversity. And this is actually what I was looking for while I was preparing the slides. CEO of Asian. Okay, good, good. That's nice. So let's begin with our topic. I would not call it geriatric health. I would just call it taking care of the older ones more appropriately, because this is what it is all about. See, you have a lot of things if you look into geriatric health, but we would be discussing a few things today, a few things that could be helpful in taking care of your loved ones around, and also your patients if you're into healthcare. So, the world is obviously aging rapidly. We would just go into a few stats. By 2050, we would have 2 billion people that would be 60 plus. And this shift is both an opportunity and a challenge. We would discuss it, obviously, but a major challenge in all of this is that what we are looking is that the older generation is particularly having a more of an extended lifespan, especially in the developed nations. And with the extended lifespan, they do not have that quality of life that they should be having while they are 60 plus. Or maybe if you could see around you, you would be having people who would be having serious chronic conditions, even 40 plus. And recently, I've been looking into a few case studies where as low as 25 years and older are also having chronic diseases, which is alarming, obviously, because when we look back, we imagined these diseases just in the 60 plus or maybe 65 plus appropriately. But now we are seeing all of these conditions, all of these health threats in the younger populations as well. The next point, which is very important, is that the majority of the older populations would be in the low and middle income countries, like the majority of us are from. And as much as the population is a concern, the concern is also that we do not have the health infrastructure or the capacity to kind of accommodate the people who are 60 plus, or kind of accommodate in a good way that they could have a fine, a good, a dignified older life. Elder abuse is obviously a huge concern. Especially in the developed countries, you would see that elder abuse is significantly becoming common, and almost 4 to 6% of the older individuals are experiencing some form of maltreatment in their homes, not from the outside, obviously. We used to imagine that, okay, the old homes have these kind of problems, but no, we have our loved ones who are not being able to take care of us properly when we get old. Global outlook of aging is that by 2050, most of the population, the quarter of half of the population would be 60 plus, and we would be having 80% of those population with at least one chronic condition. It could be hypertension, it could be a heart disease, it could be dementia, and the most common form of dementia is Alzheimer's disease. So mental health and well-being is also a concern for us. Mental health disorders would be affecting 21% of the adults and above already, and we are looking forward to it being increased threefolds by 2050. So all of these are a concern, all of these are a threat. We have opportunities to look into how are we able to take the necessary steps, the necessary preventing steps that could help this particular portion of our population. So common health challenges, these are just the common health challenges, and we would be discussing the preventive strategies also. So hypertension, diabetes, and osteoporosis in the chronic conditions are very common in the older adults. Mobility issues like falls and falls-related injuries are significantly common in this particular portion of the population. Mental health conditions, especially depression and anxiety, stays on top of the list. Nutritional deficiencies, malnutrition, dehydration are really common in this population. If you could see the low income areas, including the countries that we are living in, have a 30% higher risk of developing chronic diseases than those in the developed countries. Why? Could any of you would give me one single reason that you think where we, the lower income countries, have more of the chronic diseases than as compared to the higher or developed countries? Why do we have these chronic conditions more commonly? See, the dietary patterns are also questionable in the developed countries as well. So why is this particular factor very much highlighted in the low income countries where the chronic diseases cannot be significantly treated? What could be one reason behind that? And this particular 30% was, I think, a 5-year previous research. It has increased from 3 to 4% in the current papers. So I would open the chat box. Stress is the major reason. Researcher here, Rimsha. Hi, Rimsha. Okay, stress, depression. So mental health conditions. Okay. You think this particular area could be looked into? Poverty, yes, poverty is one of the reasons. They do not seek help. They do not go to the doctor. They do not have fine infrastructure or healthcare facilities that they could look up to. Yeah. Environment, poverty, lack of basic needs. Yes. All of them are the reasons. Lack of attention to their regular test. Yes, they do not really consider doing tests. First of all, the screening is very less in such countries, health screenings, and they do not even prefer health insurance. A lot of those things related to poverty, related to poor infrastructure, related to poor healthcare infrastructure, all of this that are related. Pollution. Okay. Nargis Ahmadi thinks it's pollution. Yeah, the environmental stresses are a factor. It's one of the factors. And obviously, we know that a lot of cancer research is happening around it. And we have seen that a lot of environmental stressors are the major reason behind the increase in cancer. Okay, so the next point that we have is 1 in 6 older adults experience abuse, often by their closed ones. We have discussed that in the beginning. And it's sad, obviously, it's really sad. But at the same time, we also need to understand why this happens. Could anyone of you guess why would this particular thing happen? You're at your home, you're old, you are weak, and you are being abused by your loved ones that you took care of when they were younger. So why is that particular cycle happening? What could be the reason? Are they insane? There are many factors. Okay, I want to know what you think about it. Why would your loved ones abuse? Adulteration in food and drinks we eat and drink. Is that the cause of abuse, or is that the cause of the chronic conditions? Okay. So abuse is directly or indirectly related to vulnerability, right? And there could be a lot of reasons of abuse. Okay. Rimsha is saying stress, generation, mental disease. Yes, mental health and well-being stays on top when we talk about abuse and neglect. And when the other person is vulnerable, there are a lot of reasons why you or the other person thinks that they are able to kind of dominate them. So all of this is related to obviously lack of empathy, stress, overthinking. They consider them as too much expensive. Yes, Ongla is coming to the point that the caregiver, the other person who is taking care of you, also needs to take care of themselves. They also have their own stresses. They also have their own financial burdens, because obviously you are completely dependent on them. Not many older adults have their insured life plans or their whole life planned and their money in place and their savings in place. No, this doesn't ideally happen. Usually what happens, and what has happened in the majority of cases, was we grew up with our parents. Our parents um, placed majority of their finances on us, on our education, on our upbringing and everything. And at the end of the day, our parents look up to us to take care of them. And that particular responsibility also puts a strain on the caregiver, on us, or on the other person, on the loved ones who are taking care of them. So when you are awareing the community about taking care of the older generation or the older population, you also need to kind of explain to them that they also need to take care of their own mental health being, mental well-being, and their own physical well-being, so that they're able to take care of their parents or their grandparents or their older loved ones. Okay, we have a comment. Abuse within families arises from a complex interplay of factors. Primarily, the abusers reside for dominance and control, which can be intensified by their own past experiences or mental health challenges. Situational vulnerabilities, such as isolation or dependency, increase the risk, and societal norms may discourage victims from seeking assistance. Yes, regardless of the circumstances, the responsibility for abuse always is with the perpetrator. Yes, we cannot justify that the act of the perpetrator is right. Obviously, whoever is abusing the other person, whoever is dominating, whoever is starting the violence is wrong. And obviously, like Dr. Maheen said, that it has a complex interplay. But whenever we as a counselor is approaching this particular topic, we need to understand that the caregiver and the care receiver both should be in their best state of mind, so that they're able to kind of adjust with the interplay that they're doing. Self-care first, my personal 100% experience. Okay, Sikandar. Yeah, Sikandar, you're on point. Dependence on caregivers, social isolation. Yeah, social isolation. We would be discussing this point. It's a very good point, actually. The isolation that the older adults face. So 95% of the older adults have at least one chronic disease that we discussed, and which is a huge stat, 95%. Almost every other person would be having a chronic disease when they get old. And for there are a few diseases that are common. Obviously, there are other diseases that can also be there, but there are a few diseases that are quite common in this particular population. So number one on top of it is Alzheimer's disease and dementia. So what is dementia? Can anybody put it on the chat box? Whatever you know about dementia. Obviously, dementia is a broad term, but we're talking about just the general definition of dementia. So it's basically related to the cognitive function. Yes, the loss of memory, the loss of memory is one aspect of dementia. Yes, the loss of the ability to make decisions, the loss of cognitive functions overall, the ability to read, the ability to focus, the ability to respond, everything is included in dementia. So your cognitive ability sort of declines in dementia. And Alzheimer's disease is one of the diseases in the broad umbrella of dementia, where you lose the memory, the forgetfulness kind of sort of peaks, and you don't remember even the smaller details of the daily life. Yeah, cognitive function, yeah. Like Dr. Maheen said. I'm forgetting a lot. Yeah, okay. So a lot of our population or the younger generation, they have this joke about dementia that I have Alzheimer's. Like if you're forgetting anything, we would say I have Alzheimer's. So how do we differentiate between a normal forgetfulness and Alzheimer's, which is also very important? And I have put that in the slide. I would discuss it now because then we would forget it. Let me just go. Okay. So how do we differentiate between the two, right? Normal aging or dementia, these are two different things. Making it bad decisions once in a while is normal aging. We do that, right? But making poor judgments and decisions, and maybe you're not even able to do the 1 + 1 = 2, maybe dementia, right? Normal aging is that you're missing a monthly payment. You forgot to pay your bills, right? This is normal aging. But problems taking care of every month's bill, you always forget to pay your bill. You forget to remember that you've did your daily functions like poo, pee, or eating. This is actually dementia. So you have taken your breakfast or not, you forget that, this is dementia. Yeah. So forgetfulness, which day it is, maybe what day is today? Guys, what is today? It's Tuesday, Monday, Wednesday, Thursday. What is it? We do forget that. It's fine. It's normal aging, right? But if you lose track of the date or the time of year, like every single time, that is dementia. So it's different. It's different from the normal aging because we have a lot of factors that are coming into play when we remind things. And we have a lot of things to remember as well. So in the normal aging, you usually forget things, but dementia is forgetting like even the smaller details that you tend to not forget in the daily life, right? Because of poor diet, yes, dementia has a role in that. We would be coming back to it. So let's just quickly wind it up. Okay, so obviously what helps? Exercise, sleep, and be smart about your diet. What could actually impact dementia when it comes to diet? Not the positive things. We all know that balanced diet is important. We all know that omega-3 helps your brain. Good fats help your brain. Complex carbohydrates helps your gut. Gut and brain has a connection. We all know these factors. But when it comes to negatively impacting, what foods could negatively impact your brain? Chalo. I'm giving you an option. Ultra processed foods. Option number 1. Right? What are ultra processed foods? What comes to your mind? Only chips and biscuits? That's it? And what else could negatively impact your brain? Refined sugar. We have a lot of evidence around it that when it comes to refined sugar, excess of it, not just obviously sugar is also important, but if you're excessively consuming refined sugar, which is white sugar, and also white flour, and baked stuff, you're routinely having baked stuff in your diet excessively. I'm not saying once in a while, obviously it's important to sort of treat yourself, but if you're excessively consuming it, it impacts your brain. It has a direct connection with your brain, right? So be smart about your diet. It's okay to have a good relationship with food, to have your favorite foods once in a while, but having it every day in every single meal would be questionable and it would impact your health. Foods with high glycemic index, yes. So high glycemic index, yeah, okay. But we have fruits with high glycemic index as well, right? But fruits would not be in this category. Only the kind of foods that are ultra processed. We would be just looking into those things. The refined sugar, excessive red and processed meat, excessive red and processed meat. Yes, excessive. Because red meat is also important for your diet. White flour, bad oils. Okay. Excessive alcohol, artificial sweeteners, trans fat. Okay. What are bad oils? Dr. Maheen would not tell us the answer because she knows this. She's a doctor. But generally, what are bad oils? What comes to your mind when you think of bad oil? Excess salt. Yes, excess salt is bad. Yeah, refined salt. But salt is important, guys. Do not eliminate that from your diet. Excessive caffeine. Yeah. Alcohol. Trans fats. Yeah, trans fats. Big one. Yeah. High in trans fats. Already used oil. Yes, these are bad oils. Usually, whenever I'm taking a youth session or especially in a university, what our generation is thinking is that seed oils are bad. So when you think about seed oils, they are not inherently bad, but excessively consuming that in ultra processed foods would make them bad. Okay, so if you're using seed oils at your home for cooking, like canola oil, cooking oils, a mix of seed oils, obviously, that's not bad for your health. Like they're not going to kill you. So we have a lot of misconceptions around that as well. Foods with high mercury levels like fish. Fish is important, right? Fish has a high mercury level, but you're not going to consume a ton of fish, right? To have that sort of mercury in your body. So fish is important, but obviously excessively consuming it, I don't know how excess would that be, but really excessively consuming it would actually impact your health. Bad oil. Okay. Yeah. Okay. Good. Sleep. I hope you guys are taking your 7 hours of deep sleep, but newer studies say that it's not important how many hours you sleep. You need to sleep properly, like you need to have a deep sleep. So what really helps is that avoid distractions around you when you're sleeping and sleep in a position that you're most comfortable in. And also for some people, 8-9 hours of sleep works. For some people, 6 hours of sleep works. For some people, 10 hours of sleep works. Whatever works for you, figure that out and sleep in that particular pattern for that much hours. So it's not a hard and fast rule that you have to sleep for 8 hours. Like 8 hours is the rule of thumb. Newer studies do not suggest that. Every person is different, right? And usually women need more sleep, tend to sleep more than the male counterparts, right? Exercise, yes, we need to do exercise. And I have compiled a list of exercise that are important for the group of people that we're talking about. Fish is very beneficial. Desi ghee and coconut oil is better option to cook. They are. But see, if we regularly cook in desi ghee or coconut oil, we would be having a lot of saturated fat in our diet, right? So a combination of desi ghee, like for breakfast, you can cook in desi ghee, perfect, or maybe coconut oil. If you oil pull, that's also great. And then obviously for the rest of the meals, you can use the other oils as well, right? I can't sleep for that long. Okay, the sleep also gets impacted when you're like 30 plus. And it actually usually declines when you're 40 plus or 45 plus or 50 plus. So you kind of tend to sleep less when you're growing older, which is also a concern, obviously. But to sleep better, you have other things that you can add on to your lifestyle routine that could really help you sleep better. But sleeping is important. Yeah, sleeping is really important, at least for 6 hours. Yeah. 30 is just a number, lol, not getting old. 30 is just a number. That's true. Actually, nowadays, 30 feels like another 20. Like you start living at 40, I guess. You kind of understand life when you're 40. So age is just a number these days. And I'm glad it is just a number because back then, when we were growing up, age used to be like, oh my God, I'm turning old. Oh my God, somebody is 45, they're old, they're dying. But it's not the case now. Which is really good. If I sleep for 24, come on, guys, 24 hours of sleep. Okay, let's go next. Depression, guys. Do we have any psychologist or psychotherapist here? They would know it better. Depression and anxiety are really common in older adults and older population. And what you can do to help it is manage stress levels. How do you manage stress levels, by the way? Because depression is something that is really common in teenagers as well. So how do you manage stress? So I have written that reach out to family and friends during rough spells, consider regular meditation. But what if you don't have the kind of family and friends that you could look up to? Then what? Going out and yes, connection with nature is also important, obviously. Yoga, meditation, yes. For me, I used to make sport, listen. Okay, sport. Yes, sport really helps. Listen music or do chores. Yeah. Keep yourself busy in work, go for a walk, focus on physical well-being. Dancing counts, yes. Zumba counts, yes. You could just turn on YouTube and start dancing. That really helps. Go for a walk, gym, fitness, crying. Yes, crying also really helps. So, studying, Nargis, do you really study in depression? I want to be like you. Nothing will work just after 3 days. I will forget. Okay. Paint, ha ha ha. Okay. So a lot of things that you guys have suggested, but when we are looking into the population that do not really likes to move or they're much dependent on us, like the old people, we really need to add on some things in their life to kind of help them cope depression. So when you're old, meeting a family member or a loved one really helps. See, we are young, we know that we can be fine by ourselves, we have 10 things to do, but for the older people, we need to help them understand that having meaningful relationships is also important. um, Obviously talk to them, you're with them, talk to them, listen to them. And the most important part is usually the older population are malnourished and they do not have a proper diet, so they do need to have a healthy diet to feel good, to kind of promote those endorphins and the dopamines and the good chemicals. And for that they need to have a good diet. So alcohol, excessive caffeine, yeah, artificial sweeteners, obviously all of these are in processed foods, right? In the packaged products, highly processed foods, all of these could be limited from their diet, and we could offer them fresh veggies, fresh fruits, smoothies, juice, complex carbohydrates to help their gut health, eventually helping their mental health and well-being. All of that could be added to their diet. So obviously the point here is nutrition is important. We need to focus on their nutrition as well. Routine exercise. So we know that exercise releases endorphins, the happy hormones in our body. And to feel good about ourselves, all of those strength trainings and the cardios are important. And for the older population, it has actually proven very beneficial. And there was one study that I was referring to, which had strength training and 35 minutes of strength training and walking combined actually reduced the incidence of dementia by 41%, which is a lot. Half of the population's dementia has gone just by exercising for 35 minutes. And also their physical and mental well-being was significantly improved. So exercise is important. We would also be discussing that in detail. Heart failure is another condition which is common. And obviously for heart failure, we all know that diet, exercise, and reducing hypertension is important. What is hypertension, by the way? What is hypertension, guys? Right. Okay. Singing, good. I mean, food, more proteins and fruit, dry fruits as well. Okay, so hypertension is basically high blood pressure, and reducing that or keeping that, managing that in a frame that is normal is very important. Even if you're 35, 40, 25, 30, whatever age you're in, you need to check your blood pressure once in a know that how your body is performing, how your body is actually responding to things, right? How do you reduce high blood pressure? The easiest strategy is obviously reducing sodium from your diet, right? Diabetes, eating a healthy diet, obviously diabetes is very common, by the way. It's especially type 2 diabetes, which is, again, sad, and it's common, and we need to treat that as well. So eating a healthy diet obviously helps. If they're on insulin, you need to monitor their carbohydrate intake and their calorie intake. And obviously, if they're overweight, especially in the case of type 2 diabetes, they need to lose weight. Even if they're 60, 65, 70, they need to lose weight. And this also goes with the findings of asthma, bronchitis, COPD. If the patients in those lung diseases are overweight, they need to reduce their weight to feel better and to reduce the worsening of their disease, right? Exercise for 30 minutes, 5 times a week. Obviously, we have talked about the exercise, the benefits. Chronic kidney disease, this is another condition, nearly overlooked, but very common. So what triggers a kidney disease is important. Diabetes and high blood pressure, these are the two common conditions that actually takes you to a point where you develop CKD, most commonly, right? So we need to sort of apply the regimens of reducing diabetes and reducing high blood pressure in this particular population, or the population who is above 50, who are in the next decade going to be 60. We can kind of include those preventative strategies into their lifestyle. Arthritis, obviously bone diseases are common, and for arthritis, again, you need to be in a normal range of your BMI, and you need to kind of focus on not gaining unnecessary pounds, and you need to make sure that your joints are in a healthy position, and for that you need to exercise at least for 150 minutes per week. 150 minutes of exercise per week. I think it's 20 minutes a day, which is not very much. You can do it, it's doable, and everyone can do it. It really helps. And for nutrition, there are a few studies that suggest that turmeric actually really helps reduce the inflammation, and it really helps with arthritis. So you can add on turmeric to their diets as well. And obviously, their multivitamins, they are important. Obviously, the calciums, the vitamin D, the minerals in their multivitamins, like potassium and copper, all of that, the B complex vitamins, all of that are important. And if they're taking a multivitamin, they should take it. Obviously, we usually suggest in the clinical settings some sort of multivitamin into their diet. Smoking, obviously smoking. Stop smoking if you guys are smoking or anybody is smoking. Don't smoke. It has no benefits. The last few are coronary heart disease. Obviously, we know that in this particular disease, a plaque is built up into your arteries, which narrows down the arteries, leading to stroke or blood clots or angina or a heart attack. So steps to avoid that is obviously limiting saturated fats, trans fats from their diet. And saturated fats and trans fats, you all know what are those fats, those kind of fats. And we also need to limit the sugar and salt intake so that they do not develop hypertension or diabetes in the long run. 7 to 8 hours of sleep. Again, we have talked about sleep. Everybody is different. Just make sure that whenever they're sleeping, they're having a quality sleep, not just the quantity sleep. Stress levels in check, cardio exercises, and obviously do not smoke, and go to the doctor if you have additional conditions with the heart disease like high cholesterol and high blood pressure. If you have in some point in your life tested and you have seen that you have a high cholesterol or you have a high blood pressure, you really need to see a doctor so that they guide you some changes into your lifestyle, and also check if you have other possible conditions, because usual chronic conditions comes with either a high blood pressure or a high cholesterol. For a high cholesterol, we all know that we do not smoke, we do not take alcohol, we stay active, we manage our weight, and obviously we minimize the saturated fats and trans fats from our diet. This is the simplest strategy to prevent the cholesterol from spiking. And with obesity, obviously, nutrition is the most important thing. Nutrition and exercise, they go hand in hand. And obviously some if you have morbid obesity, you need to go to a doctor. Nutrition and exercise would probably not help single-handedly. You need to go to a doctor if you're morbid obese. If you have a BMI of 31, 32 and above, you need to go see a doctor. They would recommend you the lifestyle changes and also the medications or strategies to reduce your BMI, because with obesity, there are hundreds of diseases that come hand in hand. For COPD, we have already discussed that. With COPD, one thing that really helps is you need to reduce your weight if you're overweight, and obviously quit smoking, quit alcohol, and if you have flu or pneumonia, and you're prone to having that because you have a COPD, you need to get your vaccines, you need to get your shots done. And obviously you need to be active. Omega-3 really helps with all sort of lung diseases. So adding on fish, adding on flax seeds, or those foods which are rich in omega-3 also would really help such patients. With hypertension, obviously, we have one single thing that you would be doing is reduce their sodium intake. Again, reduce their sodium intake. This would really, really help with their hypertension. And check their blood pressures regularly, obviously. Okay, so approximately 14% of adults age 60 and over live with a mental disorder. Sad, very sad. We have already discussed how depression and anxiety affects them, and also the kind of things that we could do as their loved ones or as their healthcare provider to help them kind of overcome depression and anxiety. One thing that is very common in our population is that we think that depression, anxiety, or any kind of mental illness is a part of age, which is not true. This is a huge myth, and depression and anxiety are treatable mental health diseases, and they can be treated with medication, with psychotherapy. They are not a normal part of aging. So considering it that, oh, they're growing old, they would be having depression, they would be having anxiety, it's okay, it's common. No, it's not. It's uncommon. It's common, but it's it's not normal, obviously. Falls, obviously. Do you have any loved one who ever fell and injured themselves in an old age and they were not able to recover, or they unfortunately could not survive by an accident where they fell? Any sort of encounter that you or your loved ones had? Okay, we have a lot of things in chat box. High blood pressure. Okay, Mediterranean diet. Yes. Mindful and thanks for that. Okay, is it true that we need to know our blood group in order to know? Okay, the blood group. There are researches that kind of addresses that maybe if a person has a certain type of blood group, certain type of foods would suit them. But this is in a very baby stage, and we do not have real or strong evidence to support the blood group diets. So if I would sort of suggest something, that would not be evidence-based. So I would say that it is kind of in a stage where it is not really evident to have a real impact of blood groups on your diet or on the frequency of diseases that you're having. Obviously, genetics are something else. Gene do play a huge part in transmitting diseases or transmitting the kind of prone to having diseases. But with the blood group, we do not have a lot of evidence how this would interplay with the kind of diet we could have or with the kind of personalities that people have. Can pregnant women do sports? I would like, yes. Dr. Maheen was playing sports, soccer till first trimester. I think we can do soft exercises, not physically straining ourselves. Yes, it also depends on how active you were pre-pregnancy, right? If you were a sporty person, if you were an athletic person, there would be no harm in doing that. But if after pregnancy you suddenly started doing some rigorous exercises, that would be questionable, and you should really avoid that. How can we convince the geriatrics for a healthy diet? Okay, yeah. We would be discussing that how could we convince the older population to have a healthy diet? What is the relation of obesity and COPD? Okay, a very good question, actually. So not just with COPD, with any kind of lung disease, we have seen a very strong evidence that reducing weight or reducing the fat mass from your body actually helps improve the disease. So this particular kind of evidence suggests that it helps not just with the COPD, with bronchitis, with asthma. If you reduce your weight, if you're obese or you're overweight and you reduce your weight, you would actually kind of improve the overall well-being. You could be able to walk, climb stairs without really sort of handling your breath, right? It really improves your breathtaking. Yes, I just witnessed this last week. Recovery. Okay. Okay. Yes, my grandpa, by car accident, he got serious mental and physical issues, then he passed away. Can a pregnant woman do sports? Okay. Okay. So by falls, obviously, a few of the patients that usually come to the ER are the people who already developed some kind of bone illness like arthritis or maybe osteoporosis, and they didn't know that, right? And when they fell, they actually fractured their bones. That fall was actually because of the weak bones, in most of the cases, right? So when we are talking about falls, we also need to understand that how important is your bone health if you want to prevent any sort of falls from actually injuring or fracturing your bone or making you sort of more dependent on someone else, right? So these sort of physical injuries are very common among this population, and over 14 million people every year experience this. And obviously, we have people 78 per 100,000 older adults, as we have seen in the 2021's research, that they have died from getting an injury by falling. So the risk factors are obviously the body's weakness, the D deficiency. Keep your D in check. Obviously, we have a lot of research around it, that how important is vitamin D, both in maintaining your physical health, but also the incident of depression is also reduced by having the appropriate level of vitamin D in your body. So even for us, obviously, vitamin D is important, and for our older generations as well. So keeping that in check is very important. I also always suggest my clients or my patients to sort of look into the vitamin D levels, get tested every 6 months, so that they kind of get an idea if they're deficient, if they're insufficient, or if they have normal levels. If you have normal levels, wow, because 89% of the population do not have normal levels of vitamin D, and which is alarming, obviously. Difficulties with walking and balance. Obviously, this comes with the difficulty in maintaining a good bone mineralization. Okay, bone demineralization is also a part of the aging process. And to maintain your bone health, you need to take the appropriate level of calcium and vitamin D and all the other vitamins and minerals in your diet to prevent the bone injuries. Obviously, we have older populations who are on medications like sedatives, antidepressants, tranquilizers. So we also need to look into their medication history as well. If they're taking any of these, if they are already having any sort of disease, you actually need to be more cautious about their bone health. If they have vision problems, they are more prone to falling, and foot pain or poor footwear. Poor footwear. This is the most neglected part, actually. Do you have any old old loved one in your house who do not wear proper shoes, who does not like wearing proper shoes? Because I do see a lot of old people coming in and they're not wearing proper shoes. I guess why do we put hard tiles on? Yeah. I believe the tiles are also a reason. We have a lot of slippery tiles at our home. So when a person is growing older, it's important for them to have a sort of grip, right? So either it could come from the right kind of shoes, footwear, or maybe we could just sort of change the tiles and make it more grip friendly. Okay. Malnutrition, obviously, 1 in 3 older adult is admitted to the hospital because of malnutrition. And malnutrition is both overnutrition, undernutrition. Both of them are in the category of malnutrition. So usually what we think is that malnutrition is always eating less or being weak. Obviously, it's being weak, but it could also be the case that a person is obese. That person is also malnourished, right? So the definition stands there, and it's highly prevalent. And obviously, we need to look into their food and their dietary habits. Like one of the questions that was on the chat box is how to convince them to eat healthy. And it's a very difficult thing because they usually do not eat very healthy. But at the same time, what really helps both in the clinic and outside of the clinic is that you need to counsel them. You need to tell them the after effects of eating a good, nutritious diet, and also the after effects of having a poor diet. And one thing that really impacts them is the dependency. If you'd actually tell them that exercising regularly, having a nutritious diet would not make you as dependent as you could be without doing that, they would really imply to that, because in that particular age, you kind of most of the people kind of suffer from the dependency, the high dependency on their loved ones, and also the fact that they're not financially able to support themselves. So having a good, healthy life is what the older generation also needs and desire. Okay, prevention strategies for healthy aging, a healthy diet. Obviously, it's a huge topic, but these are just the outlines. That high in fiber diet is very important. Most of the older people, and us as well, and the younger people as well, we do not get the kind of the amount of fiber that we should be getting in our diet. And for us, for example, in our age group, at least 35 grams of fiber is important, right? We usually tend to take only 15 grams, even if we have a good diet. So increasing the high fiber foods in their diet. And obviously for a 60 plus person, especially if that's a male, 30 grams of fiber is important. It's crucial to is a minimum amount of fiber that they should be having in their diet. Vitamins and proteins are important. Obviously, muscle building, protein plays a huge role in muscle building, which obviously we tend to lose when we are 30. After 30, each year we lose almost a few percent of our muscle mass. So to retain that, obviously we need to take protein, and obviously we need to strength train and exercise. Regular exercise, walking, stretching, strength training, routine checkups, do encourage them to go for screening assessments for vaccinations yearly, at least once yearly. Like it's the minimum that you could do. And they actually need to screen themselves for diseases, for cancer, for heart diseases, for different multiple diseases. So they need to get themselves checks from a GP, from a general practitioners, once in a year at least. Social engagement, obviously, to reduce isolation, they need to be socially engaged. And it could be anything. It could be the exercise groups. It could be going to a park. It could be talking to you. It could be being with the family. And it could also be going on a trip, right? You can take your loved ones to a trip once in a while, or they could, if you guys are from urban areas, they could go visit some village. So there are a lot of ways actually. And I usually say that internet has also served as a blessing because most of the population, around 50s, in their 50s, are using social media to kind of sort of cope with their depression and anxiety. Obviously, it's kind of giving them depression and anxiety at the same time, but they're not lonely as the previous generations were. So social media is also really helping them cope with their isolation. Gut health and nutrition. Gut health is very important, and gut directly links to the brain. We call it the second brain. So having a proper and a good gut health really impacts your physical and mental health being. And it's important for both the older generation, younger generation, and the children that are growing up. So it would influence the immunity. It would influence how you're getting the chronic diseases, and obviously it could also reverse some kind of diseases. Um, Pro tip is obviously high fiber diets, fermented foods. Both of them are important for your gut health. So with fermented foods, do you have culturally, for example, I am from Pakistan and we have achar. We call it achar. It's basically pickles, and those are a fine part of our diet, and those are fermented foods. And we also tend to eat bread because we are from the northern side of Pakistan. We have Central Asian roots, so we tend to eat breads that are fermented. So, do you have culturally some kind of foods that are fermented, like kimchi or any other sort of foods that are fermented that you guys are having in your diet? I would love to know that. People normally suggest collagen for bones. Which food with high collagen can we recommend? The best sort of source of collagen is bone broth. Bone broth is the ultimate level of collagen that you could naturally get. Simply boil the bones in water and have the broth. That's it. You would be getting your collagen. You would not be investing on supplements or the collagen powders. If you try and add bone broth into your diet, you could also make soups from that bone broth, but generally having 1 cup of bone broth is really good if you kind of if you can manage that every day. Sheep or chicken? Okay, so if you could have mutton, like that would be really good. Sheep, obviously, sheep also comes in that category. Those are good sources of collagen, but you could also have chicken. It's not like you cannot have chicken. Chicken is also a good, chicken bones are also a good source of collagen. People normally say, okay. I have also compiled how much fiber do we require. So whatever your ages are, look into it. And for 19 in between, if you're falling in between 19 to 50 years, you need 38 grams of fiber if you're a male. And if you're a female, you need 25 grams of fiber. So this is a sort of fiber requirement that is in the books, but obviously you can go beyond that, obviously, but don't go below this value, okay? So for obviously, we are discussing the older generation, so 30 grams for the male and 21 grams for the female. High fiber foods, I have compiled this list. I would send the presentation to Tahmina, and she would be sharing this with you. So the highest source in fruits is raspberries, 8 grams per cup. We have vegetables like artichokes, that is 10 grams per medium cup. And we have green peas, which are commonly used in our households. We have legumes like lentils, which is 15.6 grams per cooked cup. Obviously, which is a huge source of fiber. And whole grains like oats, like whole wheat, like barley, brown rice, quinoa, nuts and seeds like chia seeds, flax seeds, almonds, sunflower seeds. All of these are good sources of fiber, and you could actually add them to your diet and obviously to the older gen. You could recommend them to the older population as well. Okay, so what is strength training? We were talking about strength training and walking being a remedy for not just dementia, but overall the heart disease and the other prevailing diseases that are common in this population. So strength training is basically resistance training. And obviously it's different from the cardios, from the aerobic exercises like running, cycling, or walking. Weightlifting, like either with machines or free weights, is one type of strength training. And the other types include medicine balls or resistant bands or body weight bearing exercises such as push-ups, squats, or yoga. All of these are resistance trainings, and they require your muscles to contract and to lift a heavy object against the pull of gravity. So this particular kind of exercise is really important, not just for us, but for the older population as well. And this is what retains their muscle mass, which is the ultimate solution to prevention of all kind of diseases, right? So you need to preserve their muscle. They need to preserve their own muscle. And for that, they need to include some sort of strength training into their routine. And obviously, they help build the muscle. There is a science behind it. So what are the best kind of exercises for an elder? Walking plus resistance or strength training. Both of them combined could really, really help them not just prevent diseases, but to retain their muscle mass. And obviously, a new study suggests that exercise could reduce the incident of dementia from 41% to 70%, almost 70%, which is a huge number, percentage. So engaging in 1 to 35 minutes of moderate to vigorous physical activity, which is obviously strength training and aerobic exercises combined, would reduce the risk from 41%. And if you do 140 minutes of exercise per week, ideal, it would reduce your risk of dementia to 70%, almost approximately 70%, which is a huge number, obviously. So what we learn from here is that we need to not just encourage them to do exercise, strength train themselves, resistant train themselves, but for us also, this is important, right? And I have seen a sort of skinny philic. Yeah, that would be the right word. The love of looking skinny and in the younger population that are growing up, which is alarming. We need to strength train. We need to build muscle, not lose them, and to kind of and when you do not gradually lose weight, when you suddenly lose weight from the fad diets and from all the kind of things that we do to our body to instantly lose weight, we lose muscle, and we do not want to do that, because in the long run, that would not just risk us to mental disorders like dementia, Alzheimer's, but also reduce the ability of our bodies to kind of defend multiple diseases. We have a lot of chat here. Okay. I have started. Okay, good. I have started 20 as I sit a lot. After 20 minutes, get up and stretch. Great. We all should do that if we have desk jobs. It really helps. Good presentation. I think I need to work on sleep cycle. Okay. Hope everyone's sorry being late. Okay. So Dementia is a normal part of aging. A quick Q&A from you guys. True or false? Nope. Dr. Maheen, okay. Dr. Maheen thinks it's false. Anyone else? Dementia is a normal part of aging. If you forget things, if you're forgetful, if you have dementia, it is just a normal part of aging. Okay, no, good. You guys have actually listened to the presentation, so good. This is not a normal part of aging, and forgetfulness is something else. Obviously, dementia is something else, and dementia is not a normal part of aging, right? The next question we have is, older adults can't build muscle through exercise. Interesting. Can a person who is 50 plus or 60 plus build muscle through exercise? Is that actually possible? Because technically they're losing muscle mass. They can, it take time, can. Okay. Okay. Maybe, yes, they can. Okay. I think it's possible. Okay. Yes, that's actually possible. And retaining is obviously 100% possible, but they can also build some muscle mass. A few percent of muscle mass can be increased with exercising and strength training, obviously. Drinking more water can prevent dehydration-related confusion in elderly people. Is it true or false? Okay, Dr. Maheen thinks yes. True, yes, true, true, true. Okay, it's true. Yes, all of you are correct. This is true. But the sad part is, as we age, we kind of sort of the ability to understand that we are thirsty decreases. Our sensory receptors are not functioning that good. And we do not tend to understand if we are feeling thirsty or not. And especially in that population that we are dealing with, they actually tend to drink much less water than they have to. So what we could do is, obviously they can also set reminders, but we could also help them drink more water and sort of help them understand that even if they don't feel thirsty, they need to drink a glass of water every 2 or 3 hours. It's a must, right? Okay. An elderly individual struggling with managing diabetes and social isolation. There is an individual in your family that is struggling to manage their diabetes. They are diabetic and they are isolated. They have no one around. It's just you. So how would you educate and support them? Any 2 points. Like these 2 things are a must. I would do this to help them. Check on them by not hovering them, engage with them, bring food and eat together. Okay. Okay, that's a good one, actually. Make a plan for walking, giving them time and taking them out to nature. Good. All of you have creative ideas, huh? Bring food. Okay. Control the daily glycemia. Yeah, you could help them with their diet as well, because usually whoever is a diabetic, they do not really understand the kind of diets they could have, and they usually tend to fear carbs, which obviously they can have carbohydrates in their diet, but the complex carbs would be the best. Regular checking, controlled diet. Okay, constant check is important by not being a burden on them. That's correct. You can constantly check on them. You could help them compose their diet. You could just call them and ask them and listen to them if they want to talk, if they want someone to be around. Obviously, you cannot hover on them. It's not the right. It's not the right way to support someone, but you could always check on them. And educating them obviously means educating them on their nutrition, on their exercise, and on the fact that their isolation can be prevented by joining certain groups, by being a little tech savvy, that they could be able to use mobile phones and different apps that are there to help both with their physical and mental health. There are great apps that older generation could actually take benefit of, but obviously we know that that particular population, especially in the lower or middle income countries, are not that tech savvy. So we need to actually help them use that particular technology so that they are able to kind of take benefit from that, right? Why not where people don't like taste this food? Okay, Rimsha, I think it's interesting because we think that healthy food is tasteless. Do you all think that healthy food is tasteless? So whenever I take a session with youth, right, when I ask about a healthy food or a healthy diet, all they could think about is a plate of salad with some cucumbers, with some carrot, with some salad leaves. And this is what they actually imagine when we talk about a healthy diet. Instead, what a healthy diet is, your carbs, like your bread is also a part of a healthy diet. Bread with whole wheat or barley or oats, multigrain, multi-seed bread. Usually in Asian household, we make roti chapati from wheat flour. So that is also a part of your daily diet, daily plate, right? So in a plate, you have carbs, you have protein, you can have chicken, you can have any sort of meat there, right? You could have lentils there, you could have beans there. Um, and you could cook them according to your choice, according to your taste, right? And we have the third part being the raw veggies. We could have one cucumber, one carrot, and then we could have some dairy portion like yogurt. And we could also add on some fermented food like we would add on achar, someone could add on kimchi. So all of that could make a healthy plate, a healthy, delicious plate. And obviously in snacks as well, you could have apple with peanut butter, you could make some smoothie, you could have a lot of things. Actually, healthy food is actually not very tasteless if you cook them properly, and if you kind of have that habit of cooking, right? Or someone around you cooks well, so healthy food would not really look boring or taste boring to you. I have type 2 diabetes. Do I know how to also be okay, you have type 2 diabetes. Okay. No. Patient thinks about taste. But patient thinks about taste. So you could actually counsel them that you could make it the way you want to. Like, just don't put too much oil or take deep fried foods, but you could add on spices. Spices are healthy. Just don't use the packaged spices. Instead, use open spices to kind of flavor your food. You could add on a lot of things actually. So everything is healthy. Like, you should actually sort of approach your health as something that you are dealing with at home. So we know that our generation tends to eat out more, or tends to sort of deliver food more, takeouts, take-in. These are very common. So we need to kind of aware the generation that is growing up as well to eat at home, to eat deliciously healthy cooked meal. So that would actually help with the overall health and well-being. Ami cooks the best and the healthiest. She's younger than me. That's true. That's true. Okay. So the type 2 diabetes question, we would be coming back. Do I know how to help with type 2 diabetes? Obviously, number one thing that I would like to know is, how much do you weigh? What is your HbA1c? And where are you, where at what point are you in your disease, right? If you have type 2 diabetes, you must be dealing with a lot of fear around carbohydrates. So number one, complex carbohydrates can be a good part of your diet, and you need to take them to kind of manage your insulin levels. High fiber foods are important for you. And at the same time, do not fear fruits at all, because usually what I tend to see in diabetic patients, they usually tend to avoid fruits that are sweet. They tend to fear mango, apple, watermelon, all of these sweet fruits, right? You can have your fruit portions as well. And obviously, vegetables are your friends, raw veggies are your friends, and all the other foods are important in your diet, like lentils, like meat. All of those portions can also be a part of your diet. But if you're obese, if you're overweight, you need to lose weight with type 2 diabetes. This is the first and foremost and the most important thing to do if you have type 2 diabetes. So I hope all of these would help you. And please do not forget to hydrate. Usually, hydration is an issue, not just with the older population, but with the younger as well. How to deal with belly fat. Number one thing that you could do, and the only thing that you could do, and the only tip that I have for you is avoid processed carbs, white, all of the white things like white flour, white sugar, should be avoided. Don't eat bakery items, at least for a month. And then obviously kind of add them into your diet back on slowly, gradually. Treat yourself. Do not destroy your relationship with your food. But at least for a month, avoid these, and you would see your belly fat going away. And obviously, fiber is really important. So high fiber foods should be a part of your diet. Intermittent fasting helps. Yes, intermittent fasting is good. You can do that. And actually, it's very easy. You take your last meal before like at least 4 hours of gap should be there. You could eat at like around 8, your last meal, and you could sleep around maybe 11, 12, and then wake up at 8 or 7, and then take an hour break, drink water, at least 2-3 glasses of water, and then have your healthy, nutritious breakfast. And obviously, 16 hours of fast, 12 to 16 hours of fast is enough, and it really helps as well. Avoiding simply not late night snacks. Okay. So I think some evidence-based facts on preventing health problems in older people. These are researches. You could go through it. I would send the presentation, but we would just discuss the most important points. That what interventions did the researchers do, or we have in the Cochrane database or in the meta-analysis that we could actually look into, and that would help the older population. So with obviously the mild cognitive impairment or the forgetfulness or the Alzheimer's type dementia, the researchers found that physical activity as well as B12, vitamin B12 plus folic acid may benefit cognitive performance in some older adults. So what are vitamin B12 rich foods? Anybody? We have a nutritionist here. What are vitamin B12 rich foods? Beef, good. Yeah. When we are taking meat, we are taking B12, right? So with the interventions for home-based exercises, we have seen that it improved older adults' balance, muscle strength, muscle power, and muscular endurance. And we have also noticed fewer falls in that particular population that did the home-based exercise or the strength training or the strength and the aerobic exercises or the cardios combined. So exercise is important. Number 3 is nutrition. And we have seen that with nutrition, with this particular research was on home delivered meal services. So simply they were delivering nutritious meal to personalized nutritious meal to some older population, and they have seen their impacts. So what the impacts were? They were simply that they have increased energy levels and their quality of life and well-being significantly improved. So exercise for preventing falls, obviously what we would not look into this. I would ask you, what did I tell you when we were talking about falls, and 2 particular types of exercises were there which could prevent falls in the older generation? What 2 types of exercises were that? Yoga, yes, yoga was one kind of resistance training. And the next one was strength training, yes. And cardio, obviously, some sort of cardio, like walking, like running, any sort of cardio should also be included. So, hormone therapy is quite common these days, and it's a kind of trend in postmenopausal people or postmenopausal females particularly. So how effective is hormone therapy? We would be looking into that. So with hormone therapy, simply it actually recommends the US Preventative Services Task Force actually recommends against using combined estrogen and progesterone to prevent chronic conditions in postmenopausal female. And for the people who have gone through menopause and has a hysterectomy, it is recommended that using estrogen alone to prevent chronic conditions would not be enough. So the recommendations over here for any postmenopausal females are the females who have stopped menstruating, right? So the most important part for them is screening for hypertension or high blood pressure, pre-diabetes, type 2 diabetes, osteoporosis, and types of cancer. So they should regularly screen themselves instead. And obviously use behavioral counseling to promote a healthy diet and physical activity. Tips, the last one, tips for conveying health information effectively. So we, the caregivers, we, the loved ones, we are trying to take care of our loved ones, and we need to convey some information to them. Patience, obviously, slow down. Usually what happens is that older patients or older populations receive less information than younger populations do. So to kind of make them absorb the information that you give them, any sort of information, you need to slow down. You need to slow down your pace, and you need to have patience. Speak slowly. Your pace should be slow, and use easy words. Do not use jargons. Usually the younger generation uses jargons, like medical jargons, like any sort of words that they do not tend to understand, right? So use simple words, use the words that they could understand, and speak slowly. Avoid distractions. Obviously, we tend to use our phones while talking to them. Don't do that. Just if you're giving them time, just that particular time should be for them, right? Sit face to face. Usually when we sit face to face with someone, they tend to grasp more information from us. And maintain eye contact with them and listen, because they usually do not have anyone to talk to, right? So listen to them. Speak slowly, clearly, and loudly. Obviously, they have hearing impairments as well. Usually their hearing ability declines with age. So speak loudly, speak slowly, and speak clearly. And use short, simple sentences, simple words, and show them. Usually they enjoy looking at things. So you could show them a YouTube video, a simple YouTube video of some strength training exercises, or maybe some yoga positions, and you could do it with them. And maybe you could show them a new recipe that is healthy, that is nutritious, and you could cook together a simple, nutritious meal. All of these things could add on to their physical and mental well-being, and they would not just feel amazing. You would also be able to educate and aware them in a more effective manner. Okay, so the last question is, what do you think is the biggest challenge in geriatric health? Chronic diseases, mental health concerns, or nutrition and exercise? What do you see the most common condition in this particular population? And that is a challenge. That is the particular thing that they are not doing, and that is perceived to be the biggest cause in all of the diseases that they are getting. And obviously, they have a low quality of life because of that particular reason. So what do you think is the biggest challenge? Is this chronic disease, mental health concerns, or nutrition or exercise? Mental health condition, okay. Number 3, nutrition and exercise. Mental health concern, all 3 intertwine each other. Yes. Yes. Actually, all 3 of them are connected, right? If you have mental health concerns, you could have chronic diseases. You could also reduce the possibility of having a nutritious meal and exercise. If you have chronic diseases, again, you could have a mental health concern, and that could also impact your ability to have nutritious meal or exercise. But if you would see that if you're improving your nutrition and exercise, obviously the other two are declining as well. You could have less a risk of having a mental health condition or a chronic health disease. So again, all of three are intertwining and all of three are interconnected. So what could you do today? This is what I have prepared for you. But obviously, I would want you to write in the chat box 3 things that you could do today if you were going to a loved one, right? Number one, what would you suggest them? One particular thing that you would be suggesting them today, like if you're going to meet your grandparent or your father or your mother, what one thing that you could take from this presentation and suggest them today that they could add this particular thing to their diet or their exercise routine, or if they have any sort of health condition, what could help them? So any one thing that you have learned from this presentation and that you could imagine telling someone in your loved one or to your patient, anyone. Give them massage chair. Okay, that's a good one actually. I like massage chairs. I suggest them to avoiding the white things at first. Yes, refined flour, refined carbs. That's a good addition actually. So do you have people at home cooking with white flour or using refined sugar? Do we have this commonly at our households? Both my in-laws are old age, and as a family, we'll focus on more healthy eating exercises. Perfect, perfect, perfect. Have a meal plan for them. Good. Create engagement for them. Medical checkup and add nutritional foods. Perfect. Great. Great responses actually. And obviously the key takeaways would be early intervention is better than, kind of developing a disease and worsening it and then going to a doctor. So prevention and early intervention is equally important, and early screenings are obviously equally important. So at least once a year, do a complete screening, save for it. Maybe you could invest in some health insurance or whatever. It could really help improve the overall health and well-being of an older person. Mental health is equally important as physical health, and caregivers, everyone around who are supporting them also needs support and training. And health education obviously would empower not just you, but them in making informed decisions and kind of taking charge of their lives. So I hope the presentation was fruitful and you guys took something from it and you would be able to help your loved ones or your patients with this. And if you have any particular questions, you could ask today, or maybe you have my LinkedIn, my Instagram, you could message me there as well. So thank you so much for listening. Over to, okay, chat. Okay, chat. For parents, suggestion of exercise and eating and processed foods is the best. Great, Kazim. Tell them positive words that describe them. Tell them they are beautiful, they are clever. Amazing, Sia. Vanessa, to be closer to them. Thank you. Okay. Thank you, everyone. Thank you. And it was awesome meeting you all. See you then. Bye-bye.
Okay. Ladies and gentlemen, on behalf of everyone here today, I would like to extend our deepest gratitude to our distinct speaker for such a remarkable and insightful presentation on geriatric health. The depth of knowledge and passion you shared on the critical issues of prevention, care, and education in geriatric health is truly inspiring, and your expertise has not only broadened our understanding, but has also ignited a deeper commitment within all of us to advocate for and improve the health and well-being of our aging population. The information you have just shared is invaluable and will undoubtedly influence our work moving forward. Once again, thank you for your time, your wisdom, and your dedication to such an important cause. We truly appreciate all that you do. We truly appreciate Ms. Nosheen Navid and all our participants, everyone who attended. We are so delighted to have hosted you today. That was so fantastic.
Thank you, Sia.
Thank you, ma'am. To conclude, aging should be seen not as a decline, like Ms. Nosheen has been saying, but as a process that can be guided with wisdom and support. With robust health education, we can empower older adults and their caregivers with the tools to prevent illness, manage existing conditions, and maintain independence. I think as a society, it is our collective responsibility to promote better literacy and create a network of support that enriches the lives of older individuals. Let's make a commitment to ensuring that aging is not just about adding more years, but about filling those years with vitality. And once again, thank you, Ms. Nosheen, for your time and support. Thank you so much. Thank you.
Thank you so much,
Thank
Sia.
you for Women Attention.
Thank you, everyone. See ya then. Bye-bye.
Thank you, Mahin. Thank you, Tamira.